engagement for ElderHelp. I'm glad that you're able to join us for today's very important webinar topic. The topic is staying safe and living well, fall prevention for older adults. I will share more about why we are going to be talking about fall prevention in just a few minutes, and I will introduce our speaker, Jasmine, in just a few minutes as well. So let's go ahead and begin. So if you're not familiar with ElderHelp, I'm just going to give you a brief overview so that you're aware of how our organization supports older adults in the community. So ElderHelp is a nonprofit organization. We have been supporting seniors and families in the community since 1973. We provide a variety of services to help older adults continue living independently in their own homes and with the ability to age with dignity. And this just gives a brief overview of our programs. We offer information and referral service, so connecting people with resources. We offer a check-in call program called Are You OK? That helps to make sure that our clients are doing okay. They may not have many family members or friends checking in on them on a regular basis, so that helps to just have that peace of mind. We offer nutrition services through grocery shopping assistance as well as a food pantry. We offer transportation through our volunteer driving program called Seniors A Go-Go. Through our care coordination program, we offer our staff members that are degreed social workers connecting people with resources and assessing their needs along the way. We also offer a variety of volunteer services through that program. So again, helping with grocery shopping, friendly visits, home office help, and our home safety and maintenance service, which you'll hear more about later this morning. We also offer a roommate matching program called Home Share through our housing services team and our family caregiver support, which I will share a little bit more next. So through our family caregiver support program, we help to connect people with resources. So we may get calls from seniors directly, but we also get a lot of calls from family members who are looking for different organizations and programs that they could connect their loved ones to. So we're always happy to help connect those dots. We also offer webinars on a variety of topics related to being a family caregiver, or topics like today, which is about fall prevention that is relevant for really anybody. So we're happy to bring these types of topics to individuals in the community and those that might be caring for aging loved ones. We have created online courses that can be helpful for individuals who are in that caregiving journey. So I encourage anybody to check out our website. You can see all of our previously recorded webinars as well as our online courses. We partner with Alzheimer's San Diego, Southern Caregiver Resource Center, and a new resource, NaviGuide San Diego. So collectively, we're all reaching more family caregivers and providing that support that is needed for those living in our community. And why is today's topic so important? Well, we are excited to be able to be part of the Fall Prevention Awareness Week that is happening. We're joining the efforts of the National Council on Aging. So Fall Prevention Awareness Week is from September 22nd through September 26th. And there's a lot of different activities that go on throughout locally here in San Diego and also throughout the nation. So I will share more if there are any people who may be interested in attending future events this week. I'll be sure to pass along that information after this presentation as well. But it's really important that we are having these conversations because falls are prevalent, but they can be prevented. And so it is important that we are sharing that message, and there's a lot of different ways that we can prevent falls. You'll hear that in just a few minutes from our guest speaker, Jasmine, today. And so really it's a year-round topic that we want to bring up, but especially for this week, there's a lot of efforts going on to bring it to the forefront of everybody's minds. So without further ado, I am going to introduce our guest speaker, Jasmine Zepeda, and let me formally do that. So Jasmine is a program coordinator for ElderHelp. She has her background in kinesiology and gerontology and has over 10 years of experience working with seniors in different client-centered settings, including adult day centers, physical therapy settings, and as a certified chair yoga and gentle yoga teacher, primarily for seniors. Through her experiences, she has firsthand importance of movement and the dangers that falls and injuries can present. In her role at ElderHelp, she helps with our intakes, provides care coordination to clients, and helps support our volunteer services program. She also oversees our home safety and maintenance program, which is more specifically geared towards preventing falls and keeping seniors safe and around their homes. Jasmine is also a member of the San Diego Fall Prevention Task Force and is a certified senior home safety specialist. She enjoys working with clients to help provide services and resources to help them remain independent and live with dignity in their own homes. She loves being able to pursue her passion for working with and advocating for seniors and their safety. So thank you so much, Jasmine, for being with us this morning and sharing your expertise. So I will now pass it over to Jasmine. For anybody who has questions throughout the presentation, please feel free to type them into the question pane. It may show up as questions or chat, but if you type those in, we'll go through those at the end.
So much, Carrie. Hi, everyone. Good morning and welcome to the presentation on preventing falls among older adults. My name is Jasmine Cepeda, and I'm honored to be here representing ElderHelp and the San Diego Fall Prevention Task Force. As Carrie mentioned, fall prevention in general is important year-round, but especially this week for emphasizing it during Fall Prevention Awareness Week. Throughout the presentation, I'll be sharing some info on what can put you or a loved one at risk for falling, as well as sharing some tips for preventing falls. Some info might be new and some might be helpful refreshers, but I hope it's all worthwhile opportunity for you to learn how to prevent falls for yourself and for your loved ones. And as she mentioned, everyone's been muted, but if you have any questions, please feel free to add those to the question box. There'll be time at the end for some questions. Before we can address the issues of falls, we need to clearly define what they are. The World Health Organization defines a fall as an event which results in a person coming to rest unintentionally on the ground or floor or other lower level. So whether it's missing a step outside or missing a transition on a sidewalk, or like myself, unfortunately, last month, trying to get out the door with your dog and his leash in one hand and a million other things in the other hand. There are lots of potential hazards to look out for that we'll cover a little bit later here. Some common myths that we'd like to debunk about falls include how muscle and flexibility can't be regained. And yes, we do lose muscle as we age, but exercise can partially restore strength and flexibility. And it's never too late to start an exercise program, especially if you think you've been a couch potato your whole life. It's never too late to start a new program and benefit from exercise. Another one might be, if I limit my activity, I won't fall. Some people believe that the best way to prevent falls is just stay home and limit activity, which is not true. Performing physical activities will actually help you stay independent, as your strength and range of motion benefit from remaining active. And social activities are also great for your overall health. Another one might be, if I stay home, I can avoid falling, which is also not true. We know that over half of falls actually take place in the home. And then lastly, falling is something normal that happens as you get older. Falling is actually not a normal part of the aging process. Most falls can be prevented, and we do have a lot of power in reducing these risks, which we'll go over soon. Falls are an incredibly serious problem, and older adults are more at risk. Falls are the leading cause of injury and death among those over the age of 65. 1 in 4 older adults will fall each year in the United States, making falls a public health concern, especially among the aging population. And there are many risk factors for falls, some of which we'll explore later today. Falling once nearly doubles the chances of falling again. So history of falls is definitely a risk factor. Then we have here the cycle of falling. For many older adults, this can become a vicious cycle. Once a fall happens, it can be a traumatic experience, and they can develop this fear of falling. So because of that, they might kind of loop into this having a fall, fear of falling, inactivity, which then can lead to the decreased muscle strength, decreased balance, and then again, increasing that fall risk, which starts the cycle all over again. So incredibly detrimental, and doing what we can to prevent these falls. 4 steps, or our goal to break this cycle is, our goal is to break the cycle. The good news is that there are a lot of effective things we can do to prevent falls. The Centers for Disease Control and Prevention, or the CDC, recommends these 4 steps that we can take to prevent falls and to stay independent. We can speak up, keep moving, check our eyes, and make our home safer. And we'll dive deeper into each of these today in the presentation, including some problems and some solutions to help. One of the problems we might come across as we age, we can develop more medical conditions, which increases our fall risk. For example, things like diabetes can affect the ability of our feet to feel the ground due to nerve damage, which is also known as neuropathy. Poor health, especially combined with limited activity and the inability to move around, puts us at higher risk for falling. And then some medications to treat medical conditions, including dementia, can cause dizziness, drowsiness, problems with balance, a drop in blood pressure when we stand up. So all things that we need to consider and be aware of. The solution for this would be to speak up, to lower your risk of experiencing a fall due to medical condition or medications. Talk to your healthcare provider. Ask them how to best manage your health conditions, what medications may be putting you at risk, or what combinations of medications are putting you at risk. It is recommended that everyone, regardless of age, keep and maintain a medication list, which should include all over-the-counter and prescribed medications, supplements, drops, herbal products, teas, all kinds of things. And if you notice any signs of memory loss, you can schedule an appointment with your healthcare provider. Many Americans with Alzheimer's disease and related dementias don't know that they have it. So people with dementia are 4 to 5 times more likely to fall than older adults who do not have cognitive impairment. So if you notice any signs, make sure to speak up, talk to your healthcare provider, and have that support there for you. Here are some questions you can also ask your healthcare providers. Because our time with healthcare providers can be limited, it's important to come prepared to ask questions about your health, fall risk, or your loved one's health and fall risk. As a family caregiver myself, I know how overwhelming it can be to navigate medical conditions and care of a loved one, especially as things are constantly changing. So I know how helpful it's been for myself to come prepared with these kinds of questions to help ease that burden a bit. Sometimes it's hard to know what to ask or how to ask. So the San Diego Fall Prevention Task Force has created a pamphlet with a lot of information and resources, including a list of questions that can help start the conversation between you and your healthcare provider or your loved one's healthcare provider about your medications, health conditions, need for referrals, or physical activity. The questions included here are: how can my health affect my risk of falling? Can my medications contribute to a fall? Should I be taking nutritional supplements? And can physical activity reduce my risk? So all great things that your healthcare provider can give you more information about that's tailored to yourself, your loved one, your family. So just a quick chance here to do a little self-assessment. For those of you who have experienced a fall, kind of just think to yourself and think if you remember, if you talked to your healthcare provider about it, if you mentioned it to them, or if it was just something that you just kind of moved on about. As I mentioned previously, 1 in 4 older adults falls each year, but less than half actually tell their doctor about it. Your healthcare provider can provide a wide range of functional assessments to assess your leg strength, endurance, balance, and mobility. But to quickly assess your own fall risk, you might ask yourself, have I fallen in the past year? Have I felt unsteady when standing or walking? Do I worry about falling? Is that something that comes to mind often? If you answered yes to any of these, it might indicate that you do have an increased risk of falling, and further assessment from your healthcare professional is strongly recommended. So be sure to follow up if any of these kind of feels true to you or feels true to a loved one. Another problem that we see is inactivity and the fear of falling. Physical inactivity is a major risk factor for falls. When we don't move and we live in a more sedentary lifestyle, our strength, balance, and reaction responses gradually decrease. A study by the CDC found that more than 1 in 4 older Americans over the age of 50 do not meet the recommended amount of physical activity. Additionally, physical inactivity is higher among adults 50 and older with 1 and more chronic conditions. So we see that a lot higher with anyone with any chronic condition. Many older adults, especially with those with a history of falling, also experience this fear of falling. Kind of illustrated here on the right side. Someone who doesn't have a fear of falling might walk on a narrow strip of the floor with good form and at a normal pace. They might feel confident in how they walk, have a slight arm swing, and be able to look straight ahead at their path. But imagine if you put that same strip of floor up above 10 feet above a creek that's infested with alligators. What would happen? That fear might cause your muscles to tighten, might take small steps, maybe even shuffle your feet a little bit, and might look down instead of straight ahead. So going back to the cycle that we talked about earlier, that fear of falling can lead to this inactivity, decreased muscle strength, and imbalance. But it can also have non-visible effects such as social isolation, anxiety, and depression. The solution to this would just be to keep moving. To lower your risk of falling due to inactivity, try to engage in activities that improve balance and strengthen your legs. Aside from physical benefits, exercise and movement can also help boost your confidence and improve your mental health. The CDC recommends at least 150 minutes a week of moderate intensity activities, such as brisk walking, at least 2 days a week of activities that strengthen muscles, and activities to improve balance, such as standing on one foot. So maybe even while you're brushing your teeth, trying holding on maybe with one hand, little things you can do throughout your day to add up to that 150 minutes a week, make it a little bit more manageable. If you're not currently physically active, try to incorporate it into your daily routine, as I mentioned, with just balancing on one leg while you brush your teeth, or setting a daily goal of walking to the mailbox or a block, and then building up these recommendations over time. So take a moment, think to yourself, what are some ways that you might be able to incorporate some activity today, this week, this weekend, should hopefully be cooler. Are you like myself, maybe giving into the peer pressure of some pickleball? So all things that can help keep you moving and staying active. If you do have, if you do have a fear of falling, there are also several ways to overcome it. You can talk to your healthcare provider, physical therapist, an occupational therapist, and you might even consider joining some local program like a Matter of Balance that we'll talk about a little bit later to help reduce that fear of falling. And those are programs specifically designed to reduce a fear of falling and increase activity levels, staying as active as possible. And if you notice that your fear of falling is affecting your ability to be active or starting to weigh on your mental health, you can also talk to a professional or your medical provider. So yes, all these are great examples here. Even taking a moment in the middle of the day, if you've been sitting a lot, sitting and standing. And I like the photo here, maybe a few sit to stands, as long as the chair doesn't have wheels, so a sturdy chair. Getting out in the garden, doing some Tai Chi, some walking, grab a friend, go for a walk, grab your dog, just be careful that they don't pull you. So all things you could do here. And footwear. Footwear is also an important consideration. Shoes that are generally safe are those that fit well, are comfortable, and are in good condition. So heels or thick-soled shoes, kind of like in the bottom left there, can make it hard to feel the ground. So we don't typically recommend those. Flip-flops or backless slippers also don't hold your foot in place well and should be avoided. Flat loafers, like the ones circled here with minimal heel and a firm slip-resistant sole, are ideal to wear inside and outside the home. The CDC also has developed this feet and footwear for older adults fact sheet with some different health and safety tips, as well as visual examples of some safe footwear. So you can always check that out. Another problem we often see that contributes to falls is poor vision. Between the ages of 40 and 65, our eyes can go through significant changes. By 65, 1 in 3 Americans will have a vision impairing eye disease. And according to the National Institutes of Health, poor vision affects balance, increases the risk of falls and fractures in older adults. More than half of individuals 65 and older with severe vision impairment reported having a fall in the last year. And eye conditions like glaucoma or cataracts can limit your vision by making it difficult to navigate your home and your community safely. Additionally, people with dementia can have visual difficulties. Dementia affects the parts of the brain that handle visual information coming from the eyes. Some dementias that have a direct impact on vision are Lewy body, Alzheimer's, and vascular dementia. So all things to be aware of and to check in with your healthcare provider about. To help, make sure to get your eyes checked. It's important to get a dilated eye exam at least once a year to reduce the risk of irreversible vision loss, and just to make sure your glasses and your prescriptions are updated if needed. As mentioned, your vision can change, so making sure that we stay up to date. And though not mentioned on the slide, we do want to emphasize the importance of having your hearing checked as well. A lot of hearing can cause dizziness and balance problems as well. Because age-related hearing loss is common, those 60 and over should have a hearing screening on an annual basis. To help, using color contrast can highlight important objects in a room and make the environment clearer for someone with vision loss associated with dementia. So just some things you could do around your home to make it easier if you do notice a little bit more difficulty with that. All right, a lot of information so far. So take a moment here. The next issue we'll go over is environmental hazards. So just take a moment and look at the photo here. Certain hazards in our environment can have the potential to cause falls. While falls can happen anywhere, they are most often to occur in your home. So look at the photo, maybe think to yourself, what are some things I notice that could be a fall hazard? Give you a moment there. Maybe some things like the clutter. I noticed some clutter, some cords and wires in the walkway. Smoke detector obviously seems to not be working there, which can be a hazard. And it seems like they're walking down the stairway there with no railing, which can be a hazard. So what are some other things here that you might notice? And I can't see the chat, but your questions, or if you wanted to put any of that in. Or try and find them and give yourselves the gold stars.
It looks like the throw rugs came up, and the pets as well.
Yeah, great. Awesome. So next, go over some solutions. So looking at the environmental hazards, one way to help is just to make your home safer. The safer your home is, the better it is for preventing those falls. You can also talk to a physical therapist or an occupational therapist about what you can do to make your home safer. And there are several home safety checklists that you can find online at low cost or low to no cost, and programs kind of like ElderHelp with our home safety and maintenance program that offers home safety assessments, as do other organizations throughout San Diego. Some of these ways to make your home safer might be some things in the kitchen, keeping things that are within reach, so you're not having to climb on shelves or find things on the counter to minimize strain. On the stairs, you can also, well, in that photo, a railing was needed, but also applying reflective or anti-slip tape, maybe on the bottom step, to clearly see the transition of the landing, to fix any uneven steps. In the bedroom, maybe even adjusting your bed height or taping down throw rugs, making sure your walkways are clear, that there's great lighting, everything is well lit. Changes in levels of light can also be disorienting for someone with dementia. So creating an even level by adding extra lights in entries, outside landings, and areas between rooms, night lights, all some examples of ways to keep your home a little bit safer. In addition to home modifications, there are also several tools that you can use to help you or a loved one complete some daily activities to prevent those falls. And some examples here are things like a walker or a cane to improve the stability inside and outside your home. Just being sure that these are fitted to you by professional, so a physical therapist, an occupational therapist, to make sure that they're safe for you specifically. handrails and grab bars in the bathrooms or anywhere you might need one to improve mobility and offer extra support when walking or transferring in and out of the shower. There are lots of options for those. We do want to note that we typically don't recommend the suction cup type of grab bars, which can be a little less steady, more dangerous if there's water involved with slipping and kind of coming off easily. So something that's installed correctly, safely, and more firmly into the walls or into your shower walls. Rubber mats, bath chairs, things like this reacher grabber here. So all things that can be helpful. A handheld shower head, all things to make things a little bit easier. Reaching aids can also help when you're trying to reach harder to reach things. So you're not hurting yourself in the process, maybe reaching down to grab something or reaching above you to pick something up out of a drawer. And then also things like life alert or emergency response systems, which allow you to call for help should you fall. And I'll know it's important too to make sure you're testing these. I know I had a client show off how he was testing his first alert to make sure that they knew he was safe. So always making sure that they work, that they're installed correctly, and that you have those easily accessible to you. Then to recap, the 4 steps that the CDC recommends to prevent falls and stay independent are speak up. So speaking to your healthcare provider about your health, medications, and risk of falling, and maintaining that up-to-date medication list with prescription and over-the-counter meds, supplements, drops, herbal products, anything that might conflict with each other. Also keep moving by engaging in activities that improve balance and strength. And again, physical activity recommendations for older adults, which you can build up over time, are 150 minutes a week of moderate intensity activity. So brisk walking maybe, or 75 minutes of vigorous intensity activity like running or pickleball maybe. Activities that strengthen muscles at least 2 days a week, and activities that improve balance about 3 days a week, like standing on 1 foot. Also checking your eyes by getting a dilated eye exam every year, making sure your glasses or your prescriptions are all updated. And then those over the age of 60 also having a hearing screening on an annual basis. And then lastly, they're making your home safer by identifying and removing fall hazards in and around your home. So removing clutter, securing rugs and the carpets, fixing loose handrails, installing lighting in dim lit areas, grab bars, making sure your assisted devices like a cane or a walker are getting fit by a physical therapist or other health professional. So many things that we can do to help prevent falls. Also not trying to walk out your door with a million things in your hand and a very excited dog. Right. And before we conclude, I do want to share some resources, including some programs and some reliable info. One is the San Diego Fall Prevention Task Force, which is the group that Carrie and I are a part of. That consists of senior service providers, community members, and healthcare professionals who collaborate monthly on different fall prevention initiatives, events, and awareness campaigns. We have the website listed here where you can find more information and resources, including a video library on important fall prevention topics. You can also find information on how to get involved there too. The county also offers many opportunities for older adults to stay engaged. So we'll go over some of those programs that are free and open to the program. Some of these include the Feeling Fit Club, which is a functional fitness program that includes balance, strength, flexibility, and endurance exercise classes. They meet in person and online, and there's also, I think, some pre-recorded options as well. So you can find those on the county's YouTube page. They also feature that on TV as well, so we can get that information if you're interested. There's also the Healthier Living, these chronic disease programs, self-management programs. And these are all free programs and classes to help manage your chronic conditions, diabetes, chronic pain, improve your physical activity, increase socialization, and prevent falls. It's just a series of workshops that meet once a week for 2.5 hours. And all of these are led by peers. And we address how to communicate effectively with members of the healthcare team, how to manage fatigue and pain, how to properly manage medications, and so forth. So those are 2 other resources. And the County of San Diego also, and other community partners also provide several evidence-based fall prevention programs, both online and in person. I think I mentioned a matter of balance earlier. Also Tai Chi, bingo size, all great options for fall prevention programs if you want to meet in person with a group or virtually. And then there are some state and national resources as well, which include the National Coalition on Aging, which doubles as the National Fall Prevention Resource Center. It works to increase public awareness about the risk of falls and supports the implementation and dissemination of evidence-based fall prevention programs and strategies across the nation. So you can find their website here, and you can also take a falls-free checkup to assess your own risk for a fall there. There's also STEADY, which is another initiative that provides tools and resources tailored to providers as well as patients and caregivers to help prevent falls. So on their website, you can find more handouts, fact sheets, other helpful tools. All right, and then I lastly here just have information on Vial of Life. If you're not already familiar with it, it's just a plastic sleeve that has a magnet attached to the back of it, so you can put it on your fridge. And inside this sleeve, there's a form for you to complete with important information that a first responder might be able to access if they enter your home during an emergency. You can include a list of things like health conditions or disabilities, current medications and immunizations, allergies, any emergency contacts or physician information, location of where your advanced healthcare directive might be if you have one, and insurance details. So all things that can help support you in the event of an emergency. And then there's also in the sleeve a sticker that can be placed on your front door or your window to notify them to look out for that on your fridge door. So if you don't already have one, you can request that by emailing the Healthier Living team or giving them a call. And we can provide that information in a follow-up as needed. All right, so a lot of information. Thank you for your time. I hope there was something new that you were able to take away from today's presentation, either help support you or a loved one to help prevent falls. But at this time, we'll open it up for questions.
Thank you so much, Jasmine. Lots of good information. Let's see if there's any questions. Not a question, but a comment, and it is in regards to one of the resources we're going to share with you next. So, so wonderful. So hang tight to that. That's great that they're using their community resources as well.
If any other questions come up too, we'll have our contact information at the end as well.
Yes, and we will share a follow-up email that has the resources that Jasmine has shared also, so that you can reference those if you'd like to reach out to anybody specifically. And then a question did come in about footwear. So regarding the selection of footwear, many types of shoes, including loafers and tennis shoes, have very grippy soles that can lead to a fall by someone who has foot drop. So I think more of a comment. So yes, be mindful of your footwear.
Yeah, of course, it all depends on the person, but checking in with your healthcare provider is always a great start, whatever they recommend as well.
Definitely. So we do want to just share a couple of other resources. So Jasmine's mentioned our home safety and maintenance program through ElderHelp. So Jasmine, if you want to share a little bit more about that, and then we'll talk about the Challenge Center next.
Yeah, sure. As we mentioned earlier, falls can happen anywhere, but they most often occur in the home. So in efforts to help prevent these falls, at ElderHelp, we do have our home safety and maintenance program, which offers supports and services that are all geared for fall prevention. We have a team of wonderful volunteers that help with things like home safety assessments, minor home modifications, testing and replacing smoke and carbon monoxide detectors, light installations for increased visibility throughout a client's home, grab bars, railings, door and gate repairs, and a lot more. And if you are not sure what might be needed, we always recommend a home safety assessment. So we can kind of go in and take a look, and we have our wonderful volunteers who have a checklist that they go through, watch you as you walk through your home and see how they can make it easier for you in your own home. So always an option, and all projects are typically one-time requests and one-time projects, and all based on volunteer availability and skill set. So we're very lucky to have a very knowledgeable and skilled team.
Wonderful. Thank you, Jasmine. And I'll make sure to include our main phone number too for anybody who wants to reach out and inquire more about that. Here's a couple of pictures.
Yeah, just some before and afters here of some of the great work we've been able to do. A walkway repair here on the left, and then some new railings. So all great things that we wouldn't be able to do without our great volunteer team.
Wonderful, thank you. We also wanted to share about the Challenge Center. So this is another really great resource for people. They help older adults and individuals with physical disabilities to live more independently in their lives. And so they're offering a lot of great services, including physical therapy, one-on-one. They also offer group classes. They have caregiver training. They have assisted and independent different programs that can be available, aquatics program, and a lot more. So I will share information about the Challenge Center in the follow-up email so that you can reach out to them if you have questions. Currently, they're located in La Mesa, but they are going to be moving into Kearney Mesa next to ElderHelp's office and Meals on Wheels. So we're going to be kind of in a senior hub there, providing a variety of services for older adults. So we're excited about that. But definitely check them out as an option for some of those hands-on services. And one program in specific I wanted to highlight is their Agility 360 degrees total falls management program. So this is a program that has a designated time and a designated set of weeks that they go through, but it's really focused. It's perfect for this week for us to share this, improving the agility and regaining balance, making sure that people are knowing how to fall safely. So if you feel that a fall is going to happen, they're going to teach you how to do that safely, how to get up from a fall. So really looking at all of those techniques that might benefit, and every individual person is so different in their situation, so they'll work with you and figure out what might be recommended for you. So definitely focused on the safety, and it's all instructed by licensed physical therapists. So check that out for sure. And I will share that follow-up flyer in our email so that you have that to easily contact them as well. So other great resources. I just wanted to mention a save the date for our next webinar topic that will be on Thursday, October 16th, care in the late stage of Alzheimer's disease. So we will be partnering with Alzheimer's San Diego on that topic. And then here is ElderHelp's information. If you would like to reach out to us directly, our main phone number is here on the screen. It's the 619-284-9281. Can also send us an email through info@elderhelpofsandiego.org. My contact information is on the screen, and then our website. So our website has a lot of helpful information and resources as well. So I'm going to leave it on that screen. I'm going to check to see if there are any questions. And so one of the comments from one of the attendees today was about the Challenge Center that has an excellent program on teaching how to fall. So that I wanted to make sure to highlight. That's somebody who has taken the classes. So that is great. It looks like they use athletic mats and help you to fall onto those forwards, backwards, and sideways. So again, all of those different ways that might come up in our lives if we are about to have a fall. And the new location will be on Chesapeake Drive in Kearney Mesa. So Chesapeake, it's right off of Claremont Mesa Boulevard. And another question came in, if it makes sense to get a home safety check in a rental. And Jasmine, I think we would both agree that yes, even if you are renting, it's helpful to have that assessment completed because that's the environment that you're living in. So obviously, if there were projects that were recommended, that might need to be approved by a landlord ahead of time, but there might be simple suggestions that can be made that that we can help with along that way. Wonderful. I don't see any other questions. So again, you'll have our contact information, so feel free to reach out if anything comes up afterwards. But thank you so much for joining today. And hopefully, as Jasmine mentioned, if you're already familiar with how to prevent falls, hopefully this was a good reminder of some of those tips to keep in the forefront of your mind as you move throughout your day and share with anybody in your life that might be able to benefit as well. So thank you again, Jasmine, for presenting today and sharing all of that helpful information. Very good. And
thanks everyone.
Yeah, take care everyone, and I will send a follow-up with a link to the recorded version as well, so you can refer back to that. So thank you so much. Have a wonderful rest of your day and stay safe.